Hello, happy Monday everyone. Hope you're staying cool out there. It's going to be a tough week with all the rain and heat that we're going to get this week, so take care of yourself. Let's see, I'm Rundy Murphy, epidemiologist and director of the Bureau of Disease Surveillance here at the Mobile County Health Department. We are having sort of an ad hoc issue of Facebook Live. Sorry, I'll get this out. I haven't done it in a while. I'm a little bit rusty. So we just wanted to give you an update on the status of the COVID-19 outbreak in our community. And I know there are lots of people out there that don't want to hear any more about COVID. And if you're among those that you're tired of it and you feel, healthy and happy, then please, go look at something else on YouTube. But for those that appreciate the update and hearing sort of where we are and what's going on, just want to sort of share with you, cases are on the rise here in Mobile and nationally. Today we reported on a total of 118,691 cases. That is a cumulative number since March of 2020. Yesterday, I think there were about, we are seeing about 150 to 200 cases on any given day. We are still seeing people hospitalized. The number of people in the hospital with COVID has gone up. Yesterday, it was 79 people in the hospital. So that is quite a few more than we had last month this time. Most of the illnesses are quite mild, particularly if you've been vaccinated and boosted, or if you had COVID in the winter and you get COVID again now, you likely will have some immunity and have a less severe illness. But there are plenty of people who, are still getting hospitalized. And of the people who are hospitalized, the average stay is about 6 days, and about 15% of those require intensive care. So, those are usually people who are older, who have underlying medical conditions. So, if you're a healthy person and you've been vaccinated, then, probably you're going to have a very mild illness. But for those of you who, are getting up there in years, or if you have other underlying medical conditions that would make it harder for you to fight off a COVID infection should you get infected, then please, take precautions, get vaccinated. We are recommending, along with CDC right now, our COVID transmission level is high, our community level is high. So we recently repeated the information that CDC has on their website about our county and said, we really recommend masking indoors, layering on some of those prevention measures if you're one of those, if you fall into that category of being subject to more severe illness should you get infected. So again, there's on average, about 150 new cases a day, about 8 hospitalizations a day with an average number of about 65 people in the hospital. What we're not seeing is an increase in the number of deaths. We still have 1 or 2 deaths from COVID each week, but that number is staying really low. There are lots of experts out there that think, the worst of it may be behind us because we're not seeing any new variants emerge. What we are seeing are what people are calling subvariants of Omicron. So right now, this data is for the 4-week period ending the middle of June. We still were having, everything causing disease in Mobile County is thought to be Omicron. There are about 5 different subvariants. So you may hear people talking about BA4 or BA5. Right now we're seeing those account for more cases as transmission occurs in the community. But again, more highly infectious, but causes less severe illness. So all of those things are working in our favor. But again, we are in the high level. Already talked about that. We still have fairly low vaccination rates in the county if you are in the younger age groups. So, vaccine is now authorized for people 6 months and older. And if we look at our entire population, we have about half of our population that's been fully vaccinated. But if you get in those older age groups, then over 85% of them have been vaccinated. So we're really thankful that those of you who know that you might get more sick if you're not vaccinated, thank you for taking care of yourself. And, it's not too late to get a vaccine, particularly for school-age kids. If you start your series now, you'll probably have it finished before school starts. And if you're vaccinated and you get exposed, you don't have to quarantine at home. There's a provision for quarantining out, continuing to go to work, continuing to go to school, continuing to go to daycare if you've been vaccinated and you get exposed. So that would be very helpful for some families and parents that might struggle with, needing to be at home because of an exposure. We're still seeing outbreaks around the county. So, what I've been suggesting people do is think about your health and your immune status and your vaccination status, and then also think about the environment you're putting yourself in when you're thinking about COVID risk, right? So right now there are no restrictions on entering healthcare facilities or entering long-term care facilities, but remember, in those indoor locations, particularly in close quarters, that increases the risk of infection. So we recommend wearing a mask indoors, but particularly if you're going to be, visiting someone in a nursing home or, going to a doctor's visit or something of that nature. You might think about also distancing or making sure that you're always washing your hands and disinfecting and staying at home if you're sick. That's an important component. Stay at home if you're sick, and then if you aren't feeling well, or if let's say you traveled and you were around a bunch of people that you don't know, we are still providing free testing at 3 locations. You can go to our website at mchdcares.com to see where those locations are. And so get tested if you think you're just not quite feeling right, or if you have had, if you've put yourself in a high-risk situation and you just want to test yourself a couple of days later to make sure you're not infectious. A couple other just quick things, and these are, there are therapeutics available to treat COVID now. That's another reason why we probably are seeing, fewer people in the hospital. So there's an oral medicine that you can take, and you just need to contact your doctor after your diagnosis if you are, sick but not sick enough to be hospitalized, and you potentially could benefit from a round of antivirals, and those can be picked up at most large grocery store chains. And recently, FDA revised the authorization for Paxlovid. That's the name of the antiviral, Paxlovid. And now a state licensed pharmacist is able to prescribe Paxlovid. So it's making, the government is making it easier to access these life-saving medications, these ones that are going to keep you from getting really sick. And the important thing, though, is you really need to talk to your healthcare provider. If you are a provider out there, there are some drug interactions that may cause, damage to liver or kidneys. So please, Alabama Department of Public Health has they've expanded their COVID-19 therapeutics website. So please go there before prescribing Paxlovid particularly. And then the other treatment available is molnupiravir. I don't know if we have any of that in the state, but it seems like Paxlovid is the one we have the most of. All right, let me see if there's anything. You have some questions?
You want to do those last?
You can go ahead.
Okay.
Mark's got a few questions on Facebook.
My husband and I are both 68. We got our first two visors in February 2021. We were concerned about whether to go ahead and get the current booster as our 4th booster or wait.
I think I get it.
Yeah.
I think I get the name. I get this question a lot. I think you asked me this question, Mark.
Was that booster? Wait till October and November. So far, we've managed not to get COVID, but we're concerned.
Yeah. Well, it's been looking like, over the past. This is our 3rd year. We're going into our 3rd year of COVID. And when we have seen peaks, it was, late summer, early fall, and then winter. So I think I get a lot of questions, right? People saying, oh, I'm due for a booster, but I don't know if I should get it now or if I should wait a couple of months. because, it's looking like immunity wanes a bit, starting about the 6-month mark. So I think that now would be a good time to get a booster if you're eligible for one. We don't know if additional boosters, if a third booster is going to be authorized, but I think that if you're eligible for a booster, this would be a good time to go and get it.
How many home tests are reported to us?
So the question is about home testing being reported to us. So thank you. That is a really smart question. So we have talked before about the fact that, we're seeing on average 65 cases a day, but we know that that is an underestimate of the true burden of disease because home tests are not reported to public health in the state of Alabama. So we do not know how many people are testing positive at home. That's a little bit of a blind spot, I'll admit. But I think the important thing is to note that the trends are still very reliable. So the trends in our report, the percent positive, which by the way, I didn't mention this, but percent positive is up to 29%. That is all based on PCR tests. So the people who get PCR tests are usually the ones who are sick enough to go to the doctor or they're hospitalized, right? The self-test, there's many, many more self-testing going on, and we don't know what the percent positive is on those home tests.
I've had 3 COVID shots. Do I need another? I think you already.
So the question is, I've had 3 COVID shots. Do I need another one? That's a little tricky because I don't know your age or your medical situation. However, if you are eligible for a booster, then we recommend that you get one. You can go to our website at mchdcares.com, and there is a table there that will help you sort of determine if it's time for you to get another COVID shot.
Can people under 60 get a second booster?
Can people under 60 get a second booster? If you have an or if your immune system is not as healthy as a normal person, then you can get a booster under 50.
This one, I haven't had my first booster, so I get it.
Yes, you should get a booster if you're eligible for it.
There was one more. People are saying it. There's some saying that the other one is available at certain pharmacies locally.
Molnupiravir?
Oh, it was.
Oh, okay. All right. Sounds good. Let's see. There is a therapeutics locator on the ADPH website. So if you go to alabamapublichealth.gov and head to their dashboard hub, there is a therapeutics locator on there. So again, just to recap, yes, cases are on the rise. Yes, hospitalizations are on the rise, though we are seeing less severe illness. If you're eligible for a booster, please consider getting boosted. And if you are in an indoor setting, a large congregate gathering, or a large gathering, and you don't know the immune status of the people around you, consider layering on some additional measures like masking and distancing, and of course, as always, stay at home if you're sick. So if there's nothing else, hopefully, what we're seeing now is a much gradual rise in the number of cases. This is different than what we saw last fall, right? When we started seeing cases go up in November and December, it shot up and we had the fastest, tallest spike that we have seen. This is different, but it's still something to think about, particularly if you can prevent severe illness by layering on some of those prevention measures. So we will come back to you if there's more information. So we'll see you next time. Stay safe out there, everyone.